United Healthcare, Coalition of Texans with Disabilities, Raise Your Voice 2020 Advocate Connection Program, August 19th, 2020, Special Education and ECI.
Disabilities, and I'll first audio describe myself. I'm a white woman with long brown hair and black glasses. In the background is various antique things and my children's art. And I will let my mental health peer policy fellow introduce herself.
Hi, everybody. My name is Jennifer Toon, and I am the new mental health peer policy fellow at CTD. I'm really excited to be here. I will auto describe myself. I'm a white woman with short brown hair, black rimmed glasses, a spiffy, cool looking polo shirt, and in the background are several posters of Wonder Woman and cats dressed as Wonder Woman. So excited to be here.
Well, we're really happy to have you and your Wonder Woman cats here too. So the first thing we're going to do to kick this off, just so you know, this session is going to be interactive. We want to get feedback from you, and so to start that, one of the things we want to do is launch a real quick poll, and this poll will be able to. First of all, it's anonymous. You can check all that apply. And we will share the results of the poll with you during the follow-up. After this session, you'll get the results of those. So, let's see. Jennifer, do you have that? Or there we go. So we're going to leave this up here, and I'm going to read through the options. And we'll leave this up here for a few moments to make sure everybody has enough time to fill it out. So the question is, are the following among your own policy priorities? Choose all that apply. So this is multiple choice. The first one is early childhood intervention for 0 to 3 years, special education access, special education accountability, special education funding, school mental health and behavior supports, school discipline, or none of these, or something else. Maybe you have a different priority. So I'll just leave this up here for a few moments.
After poll number 1,
we're going to kick it over to Dennis. He's our executive director here at the Coalition of Texans with Disabilities. He's just going to kind of give you an overview of our organization and what Raise Your Voice is and kind of what we hope to get out of these sessions over the next few weeks. Dennis?
Hey, thanks, Jolene. So my name is Dennis Borrell. I am the executive director here, and to audio describe myself, I am an Anglo male with gray hair, gray beard, and a dark blue shirt. And like Laura, I haven't had my hair cut in about 6 months, so I'm starting to, kind of look like my younger hippie days. And you have to be old enough to understand that reference. So the Coalition of Texans with Disabilities has been around since 1978. It's a cross-disability organization, which means we can touch on all issues in the disability spectrum, all kinds of disability, all ages. For example, today we're talking about children's issues, but we'll also can be talking about many other issues through this series. Our focus is advocacy. We are certainly among the primary disability advocacy groups, have been for a long time. 2 of our core principles in advocacy is to involve you, involve the self-advocates, those with lived experience, those who are in the battle day to day, if you will. So we value you and self-advocates. We value community input. So raise your voice. The idea of raise your voice is this is community organizing. This is an opportunity for us to hear from you to hear from us, and to go forward together. And when we say raise your voice, we do mean that. We really want to hear from you. So today, as I mentioned, we're going to focus on children's issue, special education. Over the next several Wednesdays at 2 p.m., we'll have other sort of targeted issues. Next Wednesday, August 26th, will be on community attendance and wages. On September 2nd, voting for people with disabilities. On September 9th, a dental benefit for adult and Medicaid, which doesn't exist right now. And we're going to take off September the 16th and recognize DAs, ACs, which is a civil rights holiday for our Latino community. And then we'll resume on September 21st and talk about expansion of medical cannabis. So what can you expect involved in Raise Your Voice? First, we will value you, listen to you, and involve you. We will share information with you on advocacy techniques, processes of legislation, backgrounds on issues, and more. You'll work with other self-advocates, some whom you may know, some whom you will get to know, and they will be all sharing ideas, and you will share your ideas and experiences. We have an experienced CTD staff in advocacy. We'll be there to collaborate with you. And finally, what is this all for? Well, this is all in preparation for January 2021, which is the next meeting of the Texas legislature. And in each of our discussions, we're going to talk about bills and goals we have. Now, we've received an interesting question several times. Given the various quarantines, lockdowns, restrictions that are happening in our communities, how is the legislative session going to happen in 2021? Well, the answer is we don't know yet. But what we have seen is that the legislators themselves are calling for a more restricted environment. You know, exactly how that will play out, whether they will have hearings. We expect that they will, but they may not. They may go to virtual hearings. Visits may be different. We may need to have appointments to go into the Capitol rather than do what we sometimes call drive-by visits, where we go in there and just hit all the legislative offices in certain areas. So we do different things. But what I can tell you is this is how it plays out. We will keep you informed as these guidances are delivered, and we will make adjustments with you to make sure you can raise your voice. So at this point, let's dig into some issues, and I'll kick it back to Jolene.
Thank you, Dennis. So first of all, I'd like to just start out by looking at where we were and where we're headed, or where we think we might be headed this next legislative session in 2021. One of the priorities that has always kind of been a CTD priority is early childhood intervention, or ECI. And for those of you who aren't familiar with the program, it's a home-based program, school readiness program for children 0 to 3 years old who either have a developmental delay, a disability, or some other medical condition. And the array of services through ECI can include pediatric therapy, nutritional services, specialized skills training, case management. And it's been shown to be a really effective school readiness program that supports not just the kid, but the family as well. It's a very comprehensive program. So just to kind of give you a background, a legislative background on ECI, back in 2011, our lawmakers actually slashed funding to the program and narrowed eligibility to be able to access the program. So this ended up limiting access for kids who should have been served at that time. Additionally, back in 2015, the legislature cut Medicaid reimbursement rates to these pediatric therapies, OT, occupational therapy, physical therapy, and speech therapy. And that ended up hitting ECI really hard because those are all therapies that they provide, and the majority of their clients are covered by Medicaid. So this resulted basically in providers not being able to keep their doors open, and so they started dropping out of the program. So just to kind of give you some perspective, in 2011, we had 58 providers in the program. We're now down to 42 total across the state of Texas. Really, the biggest barrier to ECI to ECI services in the state is that Texas does not adequately fund ECI. So keep in mind, this is an entitlement program, meaning all ECI providers have to serve all eligible kids and can't create any kind of wait list. They can't turn kids away. So what that means is without adequate funding, ECI providers are really stretched thin, and they're always trying to figure out ways to do more with less. And so if they can't, and they can't keep their doors open, then this is why we're seeing providers dropping out across the state. So we did have some wins last session. Lawmakers actually approved additional money for ECI in the state budget. But we still need to fund the program to be able to increase the per child allotment and also fund for anticipated caseload growth. So if I'm a provider and I say I'm going to serve 200 kids, but throughout the year I serve 3,000 kids, I'm not getting paid for 3,000 kids. So CTD obviously is going to prioritize ECI in the budget. We'll also be advocating to improve referrals from childcare providers and protecting ECI respite services that we know right now are critically important to these families. So another priority every session for CTD is special education, and that includes a lot of stuff. And just as a disclaimer, we may not get to everything today, or I may not cover, the things that all of our priorities, but we're going to have an opportunity to really start having conversations after this and sharing other ideas that aren't covered here. So this is by no means an exhaustive list. So special education is kind of, how when you transition out of ECI, you transition into Part B of the Individuals with Disabilities Education Act in public schools. Some of you may know that Texas has a really long history of either delaying or denying special education services to eligible students. And the state has also been really reluctant historically to fund it at the level it needs. In 2017, lawmakers passed legislation that eliminated this arbitrary enrollment cap that many of you may know is the 8.5% cap that denied hundreds of thousands of kids the services that they need. Additionally, this past legislative session in 2019, we did make some strides through the school finance bill, House Bill 3, which among other things established full-day pre-K. It increased the special education funding weights, and it also established an advisory committee to study special education funding. There was also a provision in there to add bonuses to special education students who graduated college, career, and military ready. So this session, we plan to kind of continue to build on those strides, prioritizing funding in the budget, protecting some of those gains that we made in previous sessions to protect the rights of students, as well as advocating for transparency and accountability. So now I think I will kick it over to our mental health peer policy fellow, Jennifer Toon, who's going to discuss mental health and school discipline.
Yes, thank you, Jolene. So let's talk about mental health in schools first. We know that unidentified and untreated mental health conditions can severely interfere with academic success, damage well-being, and compound existing developmental delays. Kids with disabilities and or mental health challenges are often unidentified, so therefore they're not able to access those services that they desperately need. And several things contribute to that, such as inadequate training, school mental health personnel shortages, inappropriate discipline, and a real disconnect between schools and mental health systems. Now, in 2019, Texas moved in the right direction by making mental health in schools a priority, but they just didn't go far enough in addressing the unique needs of kids at the intersection of disability and mental health. So, right now it can be a really frightening and overwhelming time for our children. And emotional stress is really emerging as a huge barrier to learning. And COVID-19 has made it abundantly clear that providing access to behavioral and mental health supports is not a luxury, it's an urgent necessity right now. So during this next session, CTD is committed to supporting policies that bolster mental health supports for young children, and we really want to build on the gains that were made last session, such as HB 18, which requires schools to consider the mental health of all students when providing training, programming, revisions to curriculums, and services. And we really want to make sure that funding for SB 11, the school safety allotment, really dedicates a portion of funding to support student mental health strategies. We really want to support these policies that provide school districts with the training and the technical assistance in implementing multi-tiered levels of service and support. Another really important priority for us is school discipline. Students with disabilities are way overrepresented in all forms of school discipline, both formal and informal. But informal practices, which are known as shadow disciplinary practices, they're increasingly problematic. These practices include Things like isolated lunches, being locked in rooms, exclusion from recesses, shaming students in front of the whole class, and undocumented school-initiated parent pickups. Now, we're going to really be hammering away at the use of early pickups and all informal suspensions. We will also advocate for dedicated funding for restorative disciplinary practices, as well as the requirement of qualifications for campus behavior coordinators, and ensure students who need or who already have a behavior intervention plan, that these are appropriate, effective, and they're revised as needed. We are committed to eliminating this disproportionality in school discipline. And the reason why this is so important is because students that are inappropriately disciplined at school are more likely to experience trauma and really get funneled right into that school to prison pipeline and eventually drop out. So in 2021, we will really be working hard and urging the legislature to eliminate the use of any punitive practices that unfairly punish students for behaviors that are manifestations of a disability or even a response to pandemic-related stress. And with that, I'm going to turn it back over to Jolene.
Thanks, Jennifer. That's actually a really good segue to us kind of addressing the elephant in the room, which is COVID-19. The pandemic certainly highlighted some already existing challenges or concerns. And, we've also heard that it really created some new ones that obviously a lot of us could have never predicted. So whatever the 2021 session looks like, I don't think that we can go into it without addressing the impact of the pandemic. So a few things that we are already hearing that we're already trying to address and that we know will be issues in this next legislative session have to do with compensatory services. So a number of districts and ECI providers have basically already acknowledged that during the pandemic, they either had to delay or put services on hold. So what does that mean? It means that the students or these babies and toddlers in ECI were not receiving their regularly scheduled services and their critical support so that they could make progress. So that leads to regression. On the front burner for CTD is going to be ensuring that these kids get those compensatory services that they need to recover from the gaps in service provision that were not necessarily a failure on the part of the district, but were directly related to the COVID-19 pandemic. So in order to secure that, our priority is really to ensure that all the districts and the providers across the state have the resources to provide that, going back to this idea that we can't keep doing more with less, especially during this really unprecedented time. Kind of in the same vein, we're going to be opposing any attempt to push what are being referred to as mini grants or vouchers on families in exchange for relinquishing their rights to compensatory services later or to a free appropriate public education. So like I said, this is not an exhaustive list, and obviously, things are kind of day to day and even hour by hour, and we're sure that, we'll probably some new things will float to the top. But we hope this is a good conversation starter today and even after this session. So with that, I'm going to kick it over to Laura, who's going to get us started on another activity.
After that activity,
this is a series. This is not just today. And we're very pleased to be able to do this and do this at no cost. It makes it so much easier to do things this way when you can, just invite people who have the time and the will and the desire to get engaged and raise their voice. But it does cost money. So how did that happen? Well, we had a nice set of sponsors, on the sort of the silver level, CareSource, Shield Healthcare, MCNA. And on the gold level, the next higher up, the DentaQuest Partnership, AstraZeneca, and Amgen. Going up to the diamond level, Pharma, CDS in Texas, and Amerigroup. And our top funders are Heart InterCivic, United Healthcare, and Superior Health Plan. And that allowed everyone to for us to do these and continue to do these, and we will do others beyond the ones we announced earlier. You'll be getting a follow-up email with this, you know, in a further survey if you don't do the one poll you're taking. Links to the next session, how you can register there for the next several sessions. And I just want to also say that it's this really is important. As Jay said, we listen to what you say and adjust what we're doing. It all comes from you. I would just speak real briefly, and I talked about this a little bit in our breakout. A lot of people are interested in more funding for these programs. They're great programs, they return money. In other words, they save you more money than they cost, or actually bring in revenues because people can go to work because they're now successful in education. And we've been hearing people, our state leaders, talk about how this is going to be a bad session for funding any services. In fact, they're talking about, you know, shortfalls and cuts and all this. And the real answer to that is don't believe it. Don't believe it. They have a large rainy day fund. They've already gotten billions extra from the Fed, so they'll get more. There's loopholes favoring certain small groups that have been kept in place way beyond their usefulness. It could be closed. There are other ways to raise money. So remember what we're talking about when we advocate. We're talking about smart advocacy, smart public policy, things that work for our whole community, and things that ultimately are affordable. And so don't buy this idea that we're broke. We won't be broke, and it is not our worry that they come up with a budget. That's their job. We can give them plenty of ideas, but it's their job. But what their job is not to do is say, oh, too bad, go away, you folks. We're not going to serve, you know, children with disabilities. That is not an acceptable deterrent. So I'll kick it back to whoever is closing out, or is that it?
I just want to say really quickly, thank you all for your patience. I know that many of you have probably been on a million Zoom calls, or maybe you just don't like Zoom, and that's fine because we're not all, you know, super fans of it. But I appreciate your patience with us navigating this virtual platform. Normally we would be doing this in person, but we do value your feedback, and obviously none of the things we discussed today are an exhaustive list. So I hope that you will continue to share your thoughts, your recommendations, your creative solutions, and your concerns with us. So thank you for being here.